Welcome back. I'm here with our investigative reporter, Melanie Woodrow. We've been discussing the recent meningitis outbreak, and now joining us is infectious disease specialist Brad Spellberg. We're going to talk about not only putting things in perspective, because there's a lot of fear out there right now, but explaining why this meningitis is proving to be so fatal. We've talked about meningitis before. There's viral, bacterial. Fungal meningitis brings a whole host of other issues, correct?
Yeah, well, there's a bunch of different fungi that can cause fungal meningitis, and they usually cause it in patients whose immune systems are not working very well. This is a case where we've injected a very nasty fungus directly into the meninges, as you pointed out, and done it with steroids, which suppress the immune system. So it's a double whammy.
And do you all understand that? So you give a steroid injection to reduce your immune system's inflammatory response. So you're tamping down your immune response, giving a potentially deadly fungus right there, right around the spine. So what kinds of things? Because people are worried. A lot of people get steroid injections. Who should be worried? What kind of symptoms do they need to be looking out for when it comes to this fungal meningitis?
Well, you know, if you've been injected by one of these drugs, I think you need to be worried and contact your provider. The symptoms of meningitis are headaches, fever, nausea, vomiting, confusion. But you would want to catch it before that started.
And some of these patients, I don't know if you picked this up in your investigative report, but some patients are having mild headache, but they're actually having stroke-like symptoms because my understanding is the fungus is actually invading the bloodstream and causing clotting to the brain.
Yeah, so one of the nasty things about this specific fungus is it doesn't, quote-unquote, respect tissue planes. It can invade through different tissue spaces. It can invade directly into the brain, or it can invade into the blood and, as you say, cause blood clots.
Melanie and I were talking before this segment. You're an infectious disease doctor. You know, we do a lot of things in medicine. You know, we poke holes in bodies. I do think that this is also one reason to highlight sometimes less is more. You know, I was reading more and more stories about people going in to get these injections for run-of-the-mill low back pain. Why should people not only be asking where the medicine comes from, but do I really need this?
Yeah, well, absolutely. I think people need to remember any medical procedure has risks associated with it, and infection, anytime, as you say, you poke holes in the body, there is a risk of infection. So you shouldn't be doing this for just run-of-the-mill stuff.
And a lot of people are getting these shots because we know, according to the FDA, that these steroid injections were sent to approximately 23 states, and there have been illnesses and deaths reported in at least 10.
And we're going to keep you all up to date as this story evolves. Dr. Spellberg, thank you so much for being with us.
My pleasure.
Melanie, great report.